Good day, everyone, and welcome to our online webinar, where we will be diving deep into the topic of monkeypox. Let me introduce myself. I'm Aisha Basi, Director of Public Relations at YDF. As this emerging public health challenge continues to evolve, our goal today is to shed light on effective strategies to control and mitigate its impact. We are honored to have a panel of experts, their knowledge and insights helping us understand the current status of monkeypox, the challenges we face, and the future directions in managing this virus. Your participation in this discussion is crucial as we collectively work towards safeguarding public health. Thank you for joining us, and let's make this session both informative and impactful. The event will feature esteemed guests, including Rubina Bibi. She's graduated from Namal Islamabad. She's a young psychologist and director communications at YD. Our second speaker is Dr. Alina Saeed. She's graduated from United Medical and Dental College and in the batch 2024, and she's currently working as house officer at Civil Hospital, Karachi. Together, they will address the emerging monkeypox virus, focusing on its current status, challenges, and future directions. Monkeypox, a zoonotic viral disease, has seen cases reported globally, including in Pakistan. The first confirmed case in Pakistan was detected in April 2023 involving a traveler returning from abroad. Since then, the government has implemented strict monitoring at airports and entry points to curb the spread of the virus. By mid-2023, several more cases were reported, raising concern about the local transmission. Health authorities are isolating confirmed cases and raising public awareness to prevent further outbreaks. The focus remains on early detection and containment, given the close contact transmission mode of monkeypox. However, compared to other regions, Pakistan's number of cases have remained relatively low. Now, Dr. Alina Saeed will brief you about this monkeypox. Thank you.
Assalamu alaikum, everyone. I hope that you all are having a great Sunday so far. So, my introduction is being done. And thank you so much, Aisha, for introducing me and having me here right now. And let's go back to our topic of discussion today. It is emerging monkeypox virus. So let me just tell you guys that monkeypox is stands for mpox stands for monkeypox. So whenever I use mpox, so just understand that it's a monkeypox. So let's start. First of all, to understand what is mpox, what is monkeypox? Monkeypox is basically derived from monkey. Obviously, it's a name, but basically it's a viral infection illness which is caused by the monkeypox virus. And basically, you might have heard about the smallpox virus as well, which spread largely in the previous years. So it's basically from the same family, and it's basically it's a viral infection which spreads between people and animals. And one thing about it is it's a zoonotic disease. Zoonotic disease means that it is an illness which spreads between humans and animals. So whenever we come in close contact with humans and animals, we might get this monkeypox virus. And it is endemic and mostly in parts of Central and West Africa. So before we jump about going in brief discussion about how it spreads, so let me just give you a short history about it, that basically what happened that in Denmark, 1958, there was this laboratory, and in which this virus was discovered first. What happened that there were some monkeys which were imported from Malaysia for research purposes, and then they found out that there was this virus in their bodies, in their blood. So that's how it spread in the laboratory. It was discovered in 1958 firstly. And then second case in 1970, it was first human case of mpox was recorded in 1970 in the Democratic Republic of the Congo. And then in 2022, it spread around the world. And in 1970, it was just endemic in Africa, West and Central Africa. And then in 2022, the first case in UK, London, was discovered in humans. So that's how it came from. But I think it's a misnomer because it's not only found in monkeys, it's also spread from rodents as well. So yeah, people do take it misnomer. So let's go to its transmission and spread. What happens, that how it is transmitted. This is a very short, I have put some, mode of transmission over here. If you guys can understand, this is a monkey, these are monkeys and these are rodents, and that how it spreads from animals to humans. So there are some three modes of transmission. First is person to person, and second is animals to humans, and third is humans to animals, which I haven't discussed because these two are the most important and most common routes of transmission. First is from person to person, from humans to humans. That's how it spread. For example, you can see here, let me just point out, this is infected human, right? And this is an uninfected population. So how it will affect person to person? Through close contact with someone who has mpox. Like how the physical contact can be, the contact can be physical, touching, kissing, and through sexual contact as well. And although it spreads from the person who is infected with mpox, they have, when they share their clothing, bedding, or blankets, they can also be affected from that as well, from no objects as well. So that's how it spreads. And second is from animals to humans. How it will spread from animals to humans? Humans do hunt and we eat also their meat. So if there is this virus in their meat and the meat is not properly cooked somehow, it can spread. And through animal bite as well, through scratches as well, this virus can come in contact with humans from animals. So basically, while anyone can get mpox, the majority of the confirmed cases of the endemic regions in Africa has occurred in young or middle-aged men who have sex with men who had recent sexual contact with new or multiple partners. So basically, the transmission is mainly sexual. Next is recent outbreaks. When we talk about the recent epidemiology of this disease, on 23rd July 2022, the Director General of WHO declared the outbreak as a public health emergency of international concern. And then in May 2023, the World Health Organization declared an end to the public health emergency of international concern because there was this low levels of cases continue to occur. So they declared an end to that emergency thing. And then in August, 25th August 2024, there have been a total of 1,03,446 confirmed cases and 225 deaths in 121 countries still yet. On the bottom, you can see this is a recent information about the death rate, confirmed cases, and death date. And first outbreak was in London, United Kingdom. Outside of the endemic regions was considered to be Central and West Africa. And then outside the endemic region, first was UK in London. And then according to available data, between 0.1% and 10% of people with mpox have died. And they might have died due to certain complications because the mpox is generally resolved by its own. So when the person is immunocompromised, or they might have gotten some secondary infections as well from this virus, then that rate is increased. Otherwise, it just resolves by its own. And during the global outbreak that began in 2022, the virus mostly spread through sexual contact, as I discussed earlier. Okay, so the main thing here, the signs and symptoms of monkeypox. Basically, all the viral infections have almost the same symptoms like fever, headache, chills, and muscle aches, body aches, and fever, swollen lymph nodes, oral ulcers. But the characteristic feature is rash of monkeypox. And the rash is basically arrives 1 to 4 days after the symptoms, like after the fever, and it lasts like the symptom lasts around 2 to 4 weeks. And the rash are like blisters and sores, which appear from the face and then all over the body. And one period of yourself and non-infectious from the day you are having the fever and the symptoms till your rash scrubs off and you are free of rash, then only you are considered non-infectious. Otherwise, in those period from the symptoms, from the start of the symptom till the rash you are having, you can spread monkeypox. So you need to just isolate yourself. So next is the treatment. Before the treatment, I would like to say that before the treatment, I would like to just tell you guys that who are basically सबसे पहले first of all healthcare workers like me, we can easily get mpox if we are taking care of the people or the patient. People, the immunocompromised persons, they can easily get it. And now we are coming to the treatment. Treatment is basically supportive treatment. We offer supportive treatment for mpox because this is a viral infection and it mostly resolves by its own approx 2 to 4 weeks. And treatment, you can do supportive treatment like you need to maintain the hydration because in that state of infection, your body gets dehydrated. So you need to get hydration by drinking enough liquids. And pain management, you can have certain pain medications. And for fever, you can have antipyretics like fever medications. Otherwise, there are no such care for no such treatment except antivirals. Antivirals are given to those individuals who are having severe kind of infection and who are, they are susceptible to develop complications like children, immunocompromised, old age people, and pregnant ladies and HIV. They are in having their immunocompromised state. So we might consider antiviral medication. Sorry.
Can you please turn off your mic? Just a second.
What happened?
Yeah, you can continue. The mic was on, I think.
Okay, fine.
So you can. Yeah.
Thank you. So what I was telling that the treatment is mainly supportive and antiviral medications and vaccine immunoglobulins are the main management strategies for mpox. So I have told you what's the supportive care and what are the antiviral medications. Antiviral medications are given to those only who are, they have chances of being immunocompromised and they might people who might get complications in that we consider, otherwise we don't consider. And vaccines also, because people who are at risk, someone who has a close contact with someone who has mpox or someone belongs to a group of high risk of exposure, so we should be, the vaccination should be considered. Otherwise, up till yet, according to WHO, mass vaccination is not currently recommended. You can't, just vaccinate all of the people who might get mpox. You can't do that. And yeah, so let's go to the next one. how do you prevent yourself? As of COVID, how we used to do that, that was also a viral infection. And how we used to do that, we used to just isolate ourselves, and social distancing, you have to wash your hands frequently. Mpox patients themselves should self-isolate. And obviously, I told you that this is a virus which spreads through mainly through sexual contact. So you have to practice safe sex and disinfect high touch areas after visiting visitors at home. Maintain good hand hygiene. And if you have rashes, you need to take care of those rashes because they can develop into secondary bacterial infections as well. How do you take care of your rashes? You have to wash your hands, and once you touch your hand, you need to wash your hand again and again, and you need to let that area dry down. Okay, so as healthcare professionals, how would we prepare? We protect ourselves. We would wear personal protective equipment like gloves, masks, gowns, and if you are having someone with mpox, you should avoid direct contact with mpox patients. So that's how you're going to prevent it, just like COVID. So what's the public health measures to control outbreaks? This is a very important point. And what the WHO did for controlling outbreaks. First of all, you need to isolate the cases, contract tracing, vaccination strategies, and community awareness programs. These are main and the most important parts. Because when the cases arrive, you need to isolate them to decrease the spread of those cases as soon as possible. And you need to detect those cases early. That's contact tracing. And you need to make vaccination strategies and community awareness programs. This is what is going on right now. This is a community awareness program, and this is a very good initiative. In terms of that, we need to organize such programs to aware such communities so to control these outbreaks in future as well. These are some antivirals written, tecovirimat, and it is approved because it was also used for mpox, smallpox. These are not new specifically to mpox, right? So these are basically used to treat smallpox, and those are only used right now to treat mpox. There was no new vaccination, no new antivirals, because that is under the process, and it's not done yet, the new ones. So we are using the old ones that were used to treat the smallpox because they are from the same family, that's why. Coming to the challenges, what are the basic and most important challenges that are being faced by us and to, around the globe to control it? How are we not controlling it, and how is it spreading yearly more and more? So one of the biggest challenges is that the techniques to confirm diagnosis are sensitive. That's how we confirm the diagnosis of among mpox by PCR testing is done. So that is a very sensitive test, and it is very accessible in a smaller number of national reference laboratories in endemic areas also, and these are very less in number. So that's how we are getting challenged by that in terms of diagnosis. And another challenge is the lack of knowledge about the monkeypox infection, because it is a zoonotic infection, so that would be made widespread and available. Its importance should be done, especially in rural communities, because they are mostly in contact with animals, right? So the chances of underreporting may lead to surge of outbreaks, because early detection is the basic tool of treatment and to control the outbreaks. When the detection is not done, you can't stop the outbreak. So these are the challenges which are being faced. So next is future directions. What are the future strategies to be taken to prevent for future outbreaks of mpox? First of all, we need to research about the vaccine. As I told you, the vaccine is not being developed yet about specifically for mpox. So we are using that smallpox ones, and we need to research about the vaccinations to increase its efficacy, and the ones with less side effects, and antiviral drug development which are specific to monkeypox, to study the genomic structure, and then we will develop the drug. And improving surveillance and monitoring. The earlier we detect that, help in making decisions. And then community-centric strategies to raise awareness about its symptoms, transmission, and prevention measures. So that's how we're gonna direct it in the future to prevent outbreaks of monkeypox. So next is conclusion. Conclusion, it's like that this is very crucial, and monkeypox infection has the ability to spread at an alarming rate. To increase outbreak preparedness and prevention efforts, worldwide collection for improved supervision, along with detection and identification of potential cases, is necessary. As long as you detect those cases and as long as you stand as a worldwide collaboration is important, that's how you're gonna maintain and stop the outbreaks. Thank you so much for having me today. And if you have a new rash or any symptom of mpox, you need to contact your healthcare professional and take guidance about it. I hope you all got my points, and if you have any queries, you can ask me. Thank you so much.
Thank you so much, Alina, for sharing such important information. I hope it would be helpful for everyone. Thank you for joining us and giving such precious time. Now, I would request Dr. Rubina or Rubina Bibi to please share her thoughts and views about this.